As of April 24, 2025, the global landscape of viral threats presents a sobering reminder of how interconnected public health systems truly are. From vaccine-preventable outbreaks to funding cuts for long-standing treatment programs, the momentum of multiple infectious agents is once again gaining ground, despite decades of preventive progress. In the United States, measles has re-emerged with unprecedented force. More than 800 cases have been confirmed across 25 states, marking the most significant surge in decades. Texas stands at the epicenter, reporting more than 600 cases and tragically, the deaths of 2 children. This resurgence comes amidst a troubling wave of vaccine misinformation. A recent survey found that nearly 60% of U.S. adults have encountered false claims linking the MMR vaccine to autism, contributing to a decline in timely childhood immunization. Health officials are now racing against both the virus and disinformation to prevent further spread. Meanwhile, the global fight against HIV is facing a financial setback of historic proportions. Several major donor nations, including the United States, United Kingdom, France, Germany, and the Netherlands, have announced substantial funding reductions. Most notably, the U.S. has paused its PEPFAR program, which since 2003 has saved over 26 million lives across sub-Saharan Africa and other vulnerable regions. Modeling studies warn that this downturn in support could lead to between 4 and 10 million new HIV infections and nearly 3 million preventable deaths by the end of the decade. This potential reversal of decades of progress signals a critical need for renewed global commitment. In parallel, avian influenza, specifically the H5N1 strain, continues to draw concern from health authorities. Since the beginning of 2024, the United States has documented 70 confirmed and probable human cases, many linked to agricultural exposure, particularly on poultry farms and dairy facilities where viral transmission between livestock and humans remains a complex, evolving threat. Mexico recently confirmed its first human case of H5N1 in Durango, intensifying the need for border surveillance and containment strategies. Norovirus, the persistent pathogen behind countless gastrointestinal outbreaks, made headlines again this week after impacting passengers aboard the Viking Polaris cruise ship. More than 30 travelers experienced symptoms consistent with viral gastroenteritis during the vessel's 2-week voyage. The CDC is actively investigating, with norovirus suspected as the primary cause. This latest episode contributes to a growing list of cruise ship outbreaks, which have collectively reported over 2,400 cases in less than a year. In Eastern Europe, Poland is facing a bird flu crisis of its own. As of this month, the country has confirmed 79 outbreaks of highly pathogenic avian influenza in poultry populations, already surpassing last year's total. In response, the European Commission has approved a suite of emergency measures. These include expanding surveillance zones, reinforcing biosecurity controls, and deploying disinfection teams to affected areas, in an effort to stem the virus's spread both within and beyond national borders. Collectively, these unfolding events illustrate the delicate balance of modern disease control. Each of these outbreaks, whether viral, zoonotic, or misinformation-driven, exposes vulnerabilities not only in healthcare systems, but in public perception and policy execution. From the laboratories tracking viral mutations to the community clinics delivering vaccines, the global response to infectious disease remains a test of coordination, resilience, and clarity. As we move deeper into 2025, the message is clear. The threats are evolving, and so too must our preparedness. Timely communication, evidence-based policies, and sustained global cooperation are not just ideals, they are necessities. Staying informed is no longer a passive act, it is a frontline defense.